can see that they're and being made vulnerable. When we have buildings that are not wheelchair accessible, then they become vulnerable. So that is a relevant vulnerability that requires further action, i.e. making the building accessible. And who is responsible to meet those vulnerabilities? Well, I would say the architects and those who build those buildings and those who commission those buildings. So it's not up to the wheelchair user, him or herself. So who is vulnerable? So we need to be aware, do not start labeling groups. The elderly as a group, children as a group. And now I only mention the two groups that were mentioned most often during the COVID-19 pandemic. Let's take the example of the elderly. There is a difference between an elderly person who lives in a house, is self-sufficient, can go out for a walk, can order their groceries to be brought to their home because they have the money, and someone who has several medical conditions, has to live together with many people in dire circumstances. So not every elderly person is equally vulnerable. I have the concept of layered vulnerability that seem to be very, very helpful, and I have borrowed it from Florencia Luna. She's an Argentinian philosopher and bioethicist, and I have collaborated with her. And she said, if you look at vulnerability, you can see different layers. The example that I gave already shows you that there can be different layers. Being old could be a layer, but being poor is another layer. Not being able to use all kind of, for instance, digital stuff can be a layer. Not having access to certain things. And you can see that vulnerability is not a one-term condition. It's built up into different aspects. And for some people, one layer will be more on top of the other, and to others, it will be organized in a different way. So we need to make that analysis in order to know what vulnerabilities are relevant for further action. So we first need to identify what layers are important. You can be old, but because of the other conditions you live in, you do not become vulnerable. But if there is a COVID-19 pandemic and you live in an area where you live in a very small house where you cannot avoid other people, then there is that stimulus condition, because living in that cramped area shows that you will become more easily vulnerable to COVID-19 than that person who lives alone in that very well-to-do area. And they can cascade, because if you cannot access your healthcare anymore because you're supposed to stay at home, or if you cannot access healthcare because you're supposed to do something that happened here, everything online, but you do not have access to online media, then it cascades. It makes it bigger and bigger and bigger. It magnifies things. So, and once you know what layers can cascade, that's also when you can start evaluating the vulnerabilities based on their harmfulness. So being in a COVID-19 pandemic in good conditions is not as heavily to bear as living in, as I said, the cramped area and so on. So what we need to do is make that analysis. And so that's when we can only start to rank the vulnerabilities and know what obligations follow from them. So we did this exercise with a study, a large international study with people who live, well, in different continents, and what happened during COVID-19 with that study. And you could see that depending on where people lived, and for instance, there was an area in India where the research was done, but being in India is not a label for being vulnerable. It depends on the specificities. So I hope that this is clear. And once you know how the vulnerabilities can cascade, that's when you can see the harmfulness. And that's when you know what to act on. And that's when you start trying to mitigate, for instance, possible harm. And you start prioritizing. You try to avoid exacerbating layers. You try to eradicate and minimize the effects. But I could go on and on about that, but I'm a timekeeper as well. So I just continue. The philosopher Godin once said the ultimate goal of the vulnerability principle is that we need to protect the interests of groups of people who are especially vulnerable or in some way dependent on what others actually think, do, have influence on. So the thing is that once you know about those vulnerabilities, you have analyzed it, you know what layers there are, you know when it's going to cascade. It's not about, okay, so now you, vulnerable people, need to do something. It's the other way around. It's those people who are behind the cascading who have to take responsibility. And that's why, indeed, you need multidisciplinary teams to make that analysis correctly. I don't know how it was in Mexico, but in the Netherlands and in other countries in Europe, there was a lot of discussion about whether children could continue going to school or if they had to stay at home, as some argued, in order to protect the elderly. If you analyze it from the vulnerability perspective, there were lots of children that weren't safe at home. So not letting them go to school added to their vulnerabilities. So I hope that you understand that making that analysis needs to be done in a very cautious way and with an eye for where those vulnerabilities come from and how they can exacerbate. And that's why you need knowledge from different people, if possible from the people themselves as well, and otherwise for those who have real knowledge about the groups that you're talking about. The best is to have the groups themselves being represented. So the old age, that was the example that I was giving. And when you look at it, you can see that this is how we went through all these elements. And as you can see, if you analyze it for the elderly, the cascade vulnerabilities could be underlying medical conditions, so social circumstances like housing, access to healthy food, and also accessibility to vaccines. There are groups who tend to be who were avoiding the COVID-19 vaccines, and people were wondering why, because it made them even more vulnerable. And then that's one example that I found really very inspiring. There was a medical doctor who said, but I know this community. This is a community of migrant people, first generation, and they really don't understand anything of what is being told. I know their language, both literally the language, but also figuratively, what is important for them. And what this doctor did, and it was it opened up a lot of possibilities. He just went to themselves. He didn't say, you have to come to the area where you can get the vaccine. I come to you. This really was a medical doctor who had analyzed where the vulnerability was and also said, this gives me the obligation to do what is necessary. I'm going to ensure that they get access to healthcare. I could go on and on with lots of examples. I won't do that because all of you are anxiously awaiting your ceremony. But what I want to conclude about this example is that the slogan that sometimes was uttered, stay at home to protect the elderly, is too generalized and too simple. And never forget, vulnerability becomes active when specific elements are triggered. This is important. I hope that you will, that this message is the only, well, if you remember this, then I think that you can look at things in a different perspective. The last thing I want to talk about is the vaccine distribution in a global context. I relate to the work that colleagues Ezekiel, Prasad, and a lot of them have done and published in Science. Florencia Luna also was one of them. And it was a call for all countries to look beyond their own country, to look at the solidarity and the reciprocity. And it really was about how to prioritize. If you want to read a wonderful article about how to do that, how to build up the argument, this is the one that I recommend to you. And they show that if you talk about reciprocity and solidarity, you will find that if you prioritize in a way that you will reduce the possibility of getting COVID-19 in those countries that are most vulnerable, that you will also protect your own country. But that needs a different way of thinking. And they try to offer the arguments for that. It was published in Science, so you would think this is the top journal. So it will get a lot of response and people might start acting on it. And I must say that I was disappointed in the response to that. I think it was especially received in an academic world, but not that much beyond that. That's why I bring it to you, because you are those healthcare professionals and all those other disciplines that are present here of the future. And you can bring that message across to your own colleagues, your future colleagues. And I hope that you will become very vocal also internationally. That's always my hope when I give these talks to these kind of talks to young people. This is what I wanted to tell you. I'm going to stop sharing my screen. And I wish you a very happy continuation of this day. And I've heard that you produce wonderful things. And I hope that someday I will see the results of that. So thank you so much.
Thank you very much, Dr. Mackelberger, for your speech today. And we appreciate very much the effort to connect via Zoom with us here in the auditorium from the University of Groningen. Thank you very much, Doctor.
You're welcome.
Morales Pachuca Rey David, de la carrera de Economía. Y Trejo Rodríguez Lúa Fernanda, de la carrera de Médico Cirujano. Por favor, yo creo que se merecen un fuertísimo aplauso por su esfuerzo, su dedicación. Por favor, si gustan pasar un momentito todos los premiados. El primer lugar como... Muchas gracias, un aplauso. Los invitamos a pasar a sus lugares y ahora a nuestro otro grupo premiado el día de hoy, por favor. Muchas gracias. Les invitamos, por favor, a ubicarse en sus lugares nuevamente. Muchas gracias. Y ahora, señoras y señores, tiene la palabra la doctora Ana Carolina Sepúlveda Vildoso, la directora de la Facultad de Medicina de la UNAM, quien hará el cierre de este hackatón.
Muy buenas tardes a todas, todos y todes. Distinguidos miembros de la mesa de honor, estimados estudiantes, profesores que nos acompañan presencial y a distancia. Es un honor dirigirme a esta distinguida audiencia como directora de la Facultad de Medicina para compartir con ustedes los resultados de este importante hackatón, así como reconocer a quienes hoy se destacan por su dedicación e innovación. En primer lugar, deseo recapitular brevemente lo que ha ocurrido en estos días. Hemos contado con la participación de 33 estudiantes, quienes representaron 13 profesiones distintas. Es motivo de orgullo destacar la participación de compañeras y compañeros de la Facultad de Medicina Veterinaria y Zootecnia, de Física, de Administración, de Ingeniería Biomédica, de Neurociencias, Geografía, Ciencias de la Computación, Química, Economía e Ingeniería Química, entre otros, ya que su trabajo conjunto reafirma la importancia de la colaboración multidisciplinaria para enfrentar los desafíos de la salud pública. Un total de 11 conferencistas expertos brindaron sesiones sobre vigilancia epidemiológica, inteligencia artificial, ética y bioética y perspectiva de género, entre otros temas, para contextualizar a las y los participantes antes de iniciar sus trabajos en equipo. Tuvimos la presencia de 24 asesores que estuvieron disponibles desde las 4 de la tarde del 1 de marzo hasta las 6 de la mañana del 2 de marzo. Gracias a su acompañamiento, se consolidaron propuestas que integran distintos saberes y enfoques. El 2 de marzo, de 1 de la tarde a 4 de la tarde, 8 evaluadores llevaron a cabo la revisión exhaustiva de cada propuesta, tomando en cuenta la innovación, la factibilidad y el impacto en la salud pública. Destacamos también la participación del director de la OMS en México, en un evento conjunto donde se presentaron 3 proyectos y contamos con la intervención de 5 alumnos en un conversatorio, demostrando el interés de la comunidad estudiantil por la discusión internacional y la colaboración en salud. El día de hoy concluimos con 3 ponencias magistrales a cargo de expertas y expertos nacionales e internacionales, quienes compartieron su visión y experiencia para enriquecer aún más este encuentro. Ahora llega el momento que todas y todos hemos esperado. Se anunciaron los ganadores del Hackatón, pero ellos obtuvieron los premios, pero creo que todos salimos ganando, porque aprendimos una experiencia diferente de trabajo interdisciplinar basada en un reto que tiene que ver con la salud pública. Entonces, ganamos nosotros, ganó la facultad, ganó el trabajo interdisciplinario y ganamos una bonita experiencia todos. Muchísimas felicidades a todos y todas las personas que participaron. Con estos galardones damos entonces concluida esta edición del Hackatón, pero confiamos en que las ideas generadas aquí continuarán desarrollándose para fortalecer nuestras respuestas ante futuras amenazas sanitarias. Agradezco profundamente el esfuerzo de organizadores, asesores, jurado y muy especialmente de quienes participaron y demostraron que la colaboración multidisciplinaria es la clave para avanzar en la salud pública. Agradezco también a la Sociedad de Salud Pública que otorgó los premios que se acaban de otorgar. Muchas gracias a todas, todos y todes y enhorabuena a los equipos galardonados. Sigamos impulsando la innovación y el compromiso en beneficio de nuestra comunidad. Y siendo el día 11 de marzo a las 11:33 de la tarde, damos por concluida esta divertida experiencia de Hackatón 2025, COVID-19, a 5 años de la declaración de la pandemia por la Organización Mundial de la Salud. Gracias a todos por su entusiasmo y por su participación.
Bien, y antes de retirarnos, por favor, les vamos a suplicar muy respetuosamente a nuestro presidium si se puede colocar en la primera fila y todos nos agrupamos, por favor, para una foto grupal, una foto de registro grupal de este tan importante evento. En sus lugares simplemente van a estar de pie, solamente la foto está hacia acá, eso es. Se van a colocar nuestro presidium en primera fila y todos los demás de pie, por favor, en su lugar.